Hi, Dr. VIKRAM SHETTY from Clinic Golden Proportions. Here at Clinic Golden Proportions, we do a vast array of surgeries, mainly on the head and neck region, and one of the most important surgeries we do is for snoring or sleep apnea. Snoring or sleep apnea is usually considered a very social problem. People laugh at you and say, "My God, when you were sleeping, you were roaring like a train." But it's not just the sound that disturbs people, it's how it affects your health. Every time you snore and your breathing gets blocked, it reduces the amount of oxygen going into your lungs and thereby the oxygen going to your heart and your brain. And this affects your life. Today we see so many people falling down dead, 25, 30-year-olds at the peak of health. Why? It's probably because a lot of them snore, a lot of them have sleep apnea, which causes intense blockages in the breathing at night. Sometimes for a few minutes at a stretch, causing the saturation rate to dip down to as low as 60%. And this causes a severe thickening of the blood. And this causes a sluggish blood flow, which affects blood flow to the brain and the heart, causing a stroke, causing heart attacks, causing end organ failure or liver disease or kidney disease. And a lot of times, these may be attributed to post-COVID defects also, which might be true. So, correction of snoring is an exceptionally important part of today's medical health workup. At Clinic Golden Proportions here, we've been pioneering the treatment of snoring in the last 17 years. Having been trained by Professor Hermann Zeiler in Zurich, we now use a technique known as his antephase procedure or the rotation advancement procedure. We do a maxillomandibular rotation advancement. That is, a rotation and the advancement of the upper jaw and the lower jaw and the surgery on the chin to ensure that the entire jaw is brought forward, and with it we bring the tongue forward and the hyoid bone forward. This causes a dramatic increase in the airway space posteriorly. It's an exponential increase because the advancement is not two-dimensional as in the anteroposterior dimension, but it's also in the vertical dimension. So this causes a three-dimensional increase in the airway space, thus increasing the airway space exponentially, allowing the patient to breathe more freely and completely eliminating obstructive sleep apnea. This is a technique that has long-term success, and we have patients for whom we've done this technique almost 10 years back and up to even 15 years back, who today come to us and say, "Doctor, I've had 15 years of absolutely perfect sleep. No sleep apnea at all. My mind has become more fresh. I'm more fresh through the day. I don't feel sleepy through the day." They tell us that they're able to exercise more. They lose weight faster when they exercise, and their overall life possibilities have changed. Their work output has increased dramatically, and they're less irritable at home. Their family is happier with them around, and it completely changes their life. And this technique, which is being done by us and pioneered by us, is very rarely done in India and also very rarely done in the world. Very few centers do this, and the precision with which we do is far greater because we do almost 2 to 3 surgeries every week. Doing these numbers, we're able to enhance the quality of the surgery, do the surgery much faster, have lesser complications than most of the times, and we are able to manage these complications also if they do arise, which is rare. We're able to manage them more smoothly. Our results show for themselves. The AHI or the apnea hypopnea index of our patients reduces dramatically with this procedure. And this Professor Hermann Zeiler's antephase procedure or the rotation advancement of the maxillomandibular segment is able to completely change the lives of the patients. So when you see a patient or a person who tends to pant a lot with mild exercise, well, he could have a cardiac problem, but let's eliminate that in young people. But if you see a person who's panting a lot when he's doing mild exercise, it's usually because he's not able to take in a lot of breath. Amount of air entering his lungs being reduced causes him to exert more during breathing, giving the panting effect. And this is usually seen in people who have a short chin, and because of the short chin, They also have sleep apnea, which is like snoring, but a severe blockage of breathing while sleeping at night. And this kind of breathing difficulty which you see is easily treatable by our surgeries. These patients who also pant during exercise, who also have sleep apnea at night, and who have difficulty having weight loss with exercise are treated by a procedure known as rotational advancement of the maxilla and the mandible. This causes their entire facial form to come forward aesthetically, making them look better and also allowing a large amount